In this video, let me talk about the sudden infant death syndrome. Sudden means it is unexpected. Infant is less than 1 year old child and syndrome is group of symptoms. So this is called as SIDS. It is also called as a cot death because the baby dies on the bed. The definition is it is sudden, unexpected, undetectable means unidentified, unexplained death of the infant when the baby is very healthy actually. Most of the death occurs during the first 6 months, particularly 2 to 3 months of the baby's life, and most common in boy babies. Usually it occurs when the baby is asleep, although it occurs occasionally when the baby is awake. The main causes are exact causes unknown, that is idiopathic. It may affect the vulnerable babies, means weak babies. Weak babies include the premature born, the baby born before 37 weeks of gestation, pregnancy, where the lung maturity is very less, and the low birth weight means less than 2.5 kgs birth weight. So their capacity of living is also very weak. So this may occur in those babies too. It may affect due to the environmental stress, example tobacco smoke, or getting tangled in bedding. For example, if the clothes are not put in a proper way, it may come across the face, the nose, and the mouth. So it may press, ultimately blocking the airway. A minor illness may lead to a severe illness, breathing obstruction, co-sleeping, sleeping with the baby on the chair or the sofa. So what happens sometimes, the hand or the chest may press over the nose and the mouth, ultimately blocking the airway. The risk factors include prone position. The baby is laid in this way in a prone position. So this is a comfortable position where parents perceive that it is a very good and comfortable position, and the baby stops crying too. So when the baby is on this position, it may lead to sits. Soft mattress, again, if the baby it turns upside down, what happens is the nose and the mouth, the airway get stuck, and the airway has been obstructed because of the compression of the mattress. Hypothermia and sleeping aside the adults, as we have discussed earlier. Overheating, if the temperature is going to be very high, so the child may get this. So on the assessment, you can find this pulseless, whether it is going to be radial pulse or apical pulse. So both are pulseless. Okay, this is apical pulse and this is a radial pulse. And cyanosed is a bluish discoloration in the extremities. Okay, it may be in the tongue also, but here cyanosed means the blue color just because the blood circulation, the oxygen level is very less in the baby. Blood tinge, sometimes they may have bleeding here and there. And drooling of saliva, a saliva comes out of the mouth, something like the drooling over here. Urine and the stool is passed. So when the baby dies, the sphincter gets loosed. So ultimately there's bedwetting. First clench the mattress as if the child will look as if holding the bed sheet or something. So the pathophysiology is infant who died may be associated with the problems responded to these stresses, which is mentioned above, and how they regulate their heart rate, breathing, and temperature matters, and ultimately it may lead to the SIDS. So here you can see this image where the baby is in the prone positions. As we were discussing, if the mattress is very soft, so see, look at this way. The airway is being blocked. So asphyxia, there's no breathing. So this leads to the brain hypoperfusion, means the blood supply to the brain has been reduced. This is a life-threatening event. Okay. Then the baby tries to lift up, but still it gets stuck. and there's a failure of arousal means it's unable to wake up. So there's a progressive asphyxia means stoppage of breathing, ultimately lead to hypoxic coma. Hypoxic means decreased oxygen level leading to coma. Bradycardia is less than 60. Mostly in newborn it is 100, it's less than that. And the baby start gasping means the baby shows signs of breathing difficulty, and there's a failure of auto resuscitations. Look at this, ultimately the baby results in death. So what are the do's? So the baby has to be kept on the back as is shown in the image, and this is the best position. Actually, this is a supine position. Place the baby in the feet to foot position with their feet touching the end of the cot or Moses basket or pram. So what happens is it has to touch his feet over here and put it in that way so that the baby will be safe. Keep the baby's head uncovered. So don't try to wrap it. By chance, this may come across the same mouth and nose, ultimately blocking the airway. So make sure this blanket should be only high, not higher than the shoulders. Let the baby sleep in the cot or Moses basket. This is a Moses basket. Is okay. Let the baby sleep in the same room for the first 6 months, but separately away from the parents. So use a mattress that is firm, flat, waterproof, and in a good condition. As I was telling you in the previous slide, the baby gets stuck with a soft mattress. So avoid use of the soft mattresses. Breastfeed the baby as far as possible because you will be able to know how the baby's condition is. Make sure the use of a sling or the baby carrier safely. So look at this way, the face look upwards. It's not towards the chest. If it is going to be towards the chest, it will compress the face and ultimately blocking the airway. So give plenty of fluids for the baby to drink if the baby is above 4 months, and if the baby is going to have fever. Otherwise, exclusive breastfeeding is for 6 months. So prevent hypothermia by covering the head with the caps and socks in the foot. So prevent the positional plagiocephaly. This is nothing doing with sudden infant death syndrome, but this is an extra knowledge. I thought let me add it to this. Okay, prevent the positional plagiocephaly means here what happens is called as occipital baldness. The occiput get compressed. See, look at this one. Because in child, we prefer the supine position to prevent this SIDS. So ultimately, the head becomes like this, right? So make sure that you're going to change the position of the baby every 3 hourly or as far as possible. So what are the don'ts? Avoid the prone positions. The baby should be in the supine position, not upside down. And do not smoke during the pregnancy or let anyone smoke in the same room when the baby is okay. So it might be before the birth or after the birth. So do not sleep on a bed or sofa or armchair with the baby. Do not share a bed with a baby, especially when the partner smoke or take drugs or have recently alcohol drunk, or if the baby is going to be premature, is less than 37 weeks, or underweight, it is less than 2.5 kg at the birth. So do not let the baby get too hot or cold. Make sure that the room temperature is going to be 16 to 20 degree fan. This is going to be the right temperature, which is very comfortable for the adults too. And with the light bedding or lightweight baby sleeping bags, this is a bags, okay. So will be, this will provide a comfortable sleeping environment for the baby. So when you will call an ambulance or the physician, an emergency, when the baby stops breathing, that is asphyxia, or turns blue, that is cyanosis. And if you find the baby is struggling to breathe, so that is called as dyspnea, so call the ambulance fast as soon as possible. If the baby is unconscious or seems unaware of what's going on, will not wake up, means the baby doesn't speak, but you could see the baby is active. So when the baby is inactive or flaccid, so in that situation, you're supposed to call the physician as soon as possible. Has a fit for the first time, even if they seem to recover also. So, what the management is? So, provide psychological support to the family member because the baby is no more. So, if the baby is going to die the first 6 weeks after the delivery, what happens? The mother may get a psychological, postpartum blues with psychological postpubertal depression. So, in this way, what happens is then she has to be started on depression drugs and all. So, just imagine the mother is carrying 9 months baby and the baby dies after the delivery. So, what will happen to her? She'll lose and she'll feel that she's no more in the world. So make sure that you're going to help her, educate her by do's and don'ts, and make sure she avoids certain things in order to prevent this sudden infant death syndrome. So related topics available in the description. You can look at that.